My name is Strayhall, and in 2003, I was watching Presidential Hopeful and saw Kirsten with the healthcare t-shirt on and wondered what the heck that was. But knew that I was interested, having been a nurse for 17 years, I guess, and understanding what a predicament healthcare has become, what a mess it is actually, and immediately asked her what she was doing and signed up on the spot. Because I figured anything that I can do to help the public understand, you know, what the state of healthcare is, how much reform is needed, and also figure out which presidential candidate was going to represent my views on you know, what needed to be done with healthcare. So, Islands for Healthcare had a great side-by-side comparison of all the candidates and all the healthcare plans, and that was one of the most amazing, helpful pieces in the entire political process. Nobody else had anything like that. So you could literally go to each presidential candidate and feel informed at their events and ask them questions, and you know, ask them the hard questions.
Thanks, Beth. And those are coming out on December 11th is when those are going to be made available. A side-by-side comparison of each candidate's on the Democrat and Republican side of their healthcare plans. Karen?
I'm Karen Metcalf, and I'm the second Scott County coordinator here for Iowa for Healthcare. I got involved much the same way. I mean, Kirsten was amazing when they were getting Iowa for Healthcare going. She had a letter in the paper, which I saw, and just talked about what the goals were. And I had been looking for something like this because my husband's a physician, and for many years we have been frustrated by many things he sees in medicine. So it was so exciting to see an organization finally step up to the plate, say the right things, and so again, I got in touch with Kirsten immediately. We have been, I think, fairly active here in Scott County trying to keep healthcare and healthcare change on the front burner for our community. One of the things that we have done, and has been with some financial support, certainly with a lot of moral support from Iowa for Healthcare, we have a project going where we're collecting 18,000 handprints in our community, both sides of the river, Iowa and Illinois, to demonstrate that 18,000 people die each year because they don't have health care insurance in this country. And this has been a project that they've been very supportive of. We're getting there, and but this is a kind of community outreach effort that we do. We've had press events. We've talked about the S-chip reauthorization, certain pieces of legislation. We keep trying to bring